So day 11 of Ellen's keynotes study streak, and I hope you all are reading and studying the Allen's keynotes side by side and going through all the remedies and their keynotes from the Allen's keynotes. So let's take up two remedies today. Very important remedies, big remedies actually, I would say both of them. And it's day 11 of Ellen's keynote study streak. So in the past 10 days we covered many remedies, small and big, and they were connected to each other some way or the other. And yesterday we did medorinum. So today we'll do something which is more connected to medorinum as a essence of it. There are two remedies. The first remedy that we'll cover is baryta carb. So if you are reading with me, studying with me, and if you wish to take your understanding about keynotes in a better way and be a fast prescriber, open Allen's keynotes and baryta carb is the remedy. So it is especially adapted to complaints of first and second childhood, the psoric and tubercular, memory deficient, forgetful, inattentive child cannot be taught for it cannot remember, threatened idiocy. So they border on idiocy. They border on looking like someone who is an idiot, but they are not actually an idiot. They just seem to be not understanding what is told to them. So that is baryta carb for you in your clinic. They are someone who is very much raw, very much simple, very much uh, someone who does not know about the outer world at all, and they are over there in you with you, or they are hiding behind their parents if they are children, and they are very much naive, I would say. Okay, so it is suited to persons who are subject to quinsy, take cold easily. Even the least cold precipitates an attack of tonsillitis, and it is prone to land them into suppuration. The other two remedies are hepar and psorinum. So we have these patients who get exposed to cold, and immediately after a few hours they will develop tonsillitis or chest troubles or fevers and total collapse of the body. If it is most towards the glandular system, then you should think of baryta carb as the remedy, because this is what is more predisposed to attack on glandular system. People who eat outside and get gastric infections, lymph nodes come up very soon. There is infective process that starts immediately. Think about baryta carb. You will see that further as well. So there is because of the tonsillitis, there is inability to swallow anything but liquids. Other two remedies are baptisia and silica. Swelling and indurations or incipient suppuration of the glands, especially cervical and inguinal. There is offensive foot sweat. We saw this in sanicula, we saw this in silica, we saw this in calcarea carb. We will see in many other remedies. We saw in medorinum also. But over here, the toes and the soles get sore, especially of the heels. And there are throat affections when the foot sweat is suppressed. Sometimes they are washed too soon. Sometimes they are rubbed with a cloth and the perspiration is not allowed to come out. Sometimes they are wearing socks or some woolen clothing and the perspiration is not brought out. In those patients, throat affections develop immediately, and such patients will require baryta carb. You should compare this with graphitis, psorinum, sanicula, silica. I discussed those few remedies, and we'll discuss psorinum also. Next we have is great sensitiveness to cold. The other remedies being calcarea carb, kali carb, and psorinum. It is preeminently a remedy for children and the elderly people. So you can say extremes of life. We also saw this mentioned in Ethusa. So when you read these remedies in connection, you have a clear link of what is mentioned in which remedy, and you establish a link, and you are in a position to prescribe better when the patient lands in front of you. The children are scrofulous dwarfish who do not grow, and there is scrofulous ophthalmia, cornea opaque, abdomen swollen, frequent attacks of colic, face bloated, general emaciation. So if the child is not growing fast, they are growing slowly, all the milestones are delayed, baryta carb is one of the remedies to be thought. It is actually a psychotic trait if you read the miasms from Dr. Hahnemann and Dr. H.C. Allen. If the children are growing too fast, then the remedy is calcarea carb and calcarea phos. Over here in baryta carb, the children are both physically and mentally weak. There is chronic cough in psoric children. You will also see this in lycopodium, psorinum also. And there is enlarged tonsils or elongated uvula, aggravated by slightest cold. This is also there in alumina. Incidentally, surprisingly, alumina is one of the remedies which is mentioned over here for such complaints, and I am surprised how it is there. It is mostly suited to people who are dwarfish, hysterical women, old maids with scanty menses, deficient heat, and always cold and chilly. Old cachectic people who are scrofulous, especially when they are fat, or those who suffer from gouty complaints. The other remedy mentioned over here is fluoric acid. Diseases of old man, hypertrophy or induration of prostate and testes glands, mental and physical weakness. So you have these people who develop localized problems. If you read the remedy throughout and you go over the salient features, you will see that there is a tendency to get localized affections. It can be in the throat, it can be in the testes, it can be in the inguinal glands, mesenteric glands, anywhere localized, prostate glands. Those areas, if you see you have a patient who arrives to you with a pathology, it is only in one part, then you should think of the remedy baryta carb as the top remedy. Apoplectic tendency in old people, complaints of old drunkards, headache of aged people who are childish. So I had once in charge with me an old age ashram over here where people who are more than 60 years, 70 years, who are not with their family are kept, and they were kept over here. So they usually used to have such grave pathologies, and baryta carb is suited to more of these people who have these pathologies which is localized. So you have a patient who is having localized pathology, glandular system affections, who is old, who is not looked after. You can think of baryta carb, you can think of mac carb, you can think of magmune, you can think of alumina, and there are other remedies, but more of carbon remedies and more of magnesium also can be thought. Baryta also can be thought, because they need a dependence for someone to be there, and they are over here also dependent on someone, although they are away from their family, but still they are dependent on someone.
Hemorrhoids protrude every time he urinates. Now, this is a very subjective symptom. You will need to ask the patient of hemorrhoids if he complain of this symptom. It's a very small thing which we need to probe very minutely. Similar presentation we also have in muriatic acid. Aggravation is similar to medorinum, which we saw yesterday. When thinking of the disease, oxalic acid is another remedy. Lying on painful side aggravates, and after meals and washing affected parts is also aggravation for baryta carb. Baryta carb is frequently useful before or after psorinum, sulfur, and tuberculinum. So the next remedy what we will be studying is psorinum. And after baryta carb, if there is a tendency to quinsy, tonsillitis, or any pathological condition which is dependent on the immediate cold which they catch, you can think of the remedy psorinum as a constitutional tendency to eradicate the quinsy. It is similar to alumina, calcarea iode, dulcamara, fluoric acid, iodine, and silica. And it does not go well with calcarea carb in scrofulous affections or in psoric affections. So let's go further and read psorinum as the next remedy. And this is a very important, and you can say that it is kind of a important nosode, I would say. So when we open psorinum is actually a diseased product of the glands which are already having lot of waste materials. So it is actually derived from the filth, you can say. So in chronic cases, when well selected remedies fail to act, fail to relieve, or permanently improve, in some cases where you feel that the patient is improving but he has come to a standstill, think about psorinum. If it is acute disease, think of sulfur. If it is chronic, think of psorinum. Also, when sulfur is indicated in acutes but it does not act, think about psorinum. There is ailments from suppressed itch or skin diseases. So we already discussed in sulfur, I think 4-5 days ago. Whenever you have a patient who lands up from the skin specialist, look at what the prescriptions are and think about giving sulfur in low potencies, wait for 2 to 4 weeks and then give the next remedy. Similar thing we can do with psorinum. Although in psorinum there is something else which will come to that point in skin, the skin chapter. So for psorinum we have ailments from suppressed itch or skin disease when sulfur fails to relieve, severe or from even slightest emotions, especially adapted to psoric constitution, extremely psoric patients who are nervous, restless, easily startled, anxious, full of fear, evil forebodings. There is religious melancholy, very depressed, sad, suicidal thoughts, despair of salvation, of recovery. The other remedy mentioned in the bracket is melilotus. It's a small remedy. So you have these patients, who always think negative, who always say that I don't know what my future is. I always have negative thoughts, whether I'll be able to succeed in my life, whether I'll be able to achieve the success I am looking for, whether I am in this job I'll be able to get my desired level of success. Those patients require psorinum. One of the rubric is pessimist. It's a newly coined rubric. I would say that it's not a classical rubric. So there are a set of rubrics which are classical. There are a set of rubrics which are not classical, which are kind of newly coined because of these terminologies all collected. Anxious, forebodings, gloomy, sad, depressed. These all bring together a word which is known as pessimism. So it's a newly coined rubric. It's available in latest repertories, not the classical Kent repertory. It has psorinum as one of the mention. If you go and check synthesis repertory, complete repertory, or any other latest repertory. Now, The next thing what is mentioned for psorinum, and you will see many of the doctors who prescribe tonics to patients after they get some acute disease. Rather than giving tonic, you should give them psorinum. So the next line what you see, lack of reaction after severe acute disease, appetite will not return. So I guess it's day 11 of Ellen's keynote study streak, and you all are, I hope you all are learning well and excited, and you know getting you know me- memorized with the symptoms mentioned and mesmerized with how they will be presented in the clinic. And if you are coming to this symptom which the patient says that I since the time I have had fever, it's been 15 days and I cannot eat well. Give Sorinum few doses like 30 potency or 200 potency thrice a day or 4 times a day for 2-3 days, and you will see on the third and fourth day there will be lot of improvement in his appetite. So children who don't get well immediately after an acute illness, Sorinum will push them and put them back on track. Adults who don't get the appetite or the energy to work well, Sorinum will put them back on track. Okay, so there is great weakness and debility from loss of animal fluids remaining after acute disease, independent of or without any organic lesion or apparent cause. So these are the two lines that Ellen mentions for complaints that have happened after an acute phase of disease. Going further, we have body has a filthy smell even after bathing, and this smell kind of exists in all nosores or products of disease which are available to us as remedies. The whole body is painful, easily sprained and injured. Easy sprains, we saw this also in natrum carb, ledum pal, we'll see in arnica also, we'll see in ruta also. Great sensitiveness to cold air, we saw this in baryta carb. So you see this symptom which is an extension of baryta carb into Sorinum, and patients where you give baryta carb, if you follow it up with Sorinum, you are going to have a long-term cure rather than just giving baryta carb and stopping there. Great sensitiveness to cold air or change of weather, wears a fur cap, overcoat or shawl even in the hottest summer weather. So it's not about exactly wearing those clothes or those things that are mentioned over here, but you will have patients who will wear 2 or 3 layers of clothes, who will say that your fan, your clinic's fan or the external air or the air conditioning at my relative's place or wherever I go, I cannot tolerate, and that is why I keep on wearing 2 layered clothes. And there will be people who won't wear any layer, just 1 layer of cloth. That actually qualifies for a kind of a ambithermalness towards chilliness, ambithermalness towards heat. In stormy weather, he feels acutely restless for days before or during a thunderstorm. This is very much similar to phosphorus. Dry, scaly eruptions disappear in summer, return in winter. Now, there is a very beautiful symptom, and I have cured many cases based upon this symptom, which I am going to read further. But how will the patient explain to you? कल तक तो सब ठीक था, बहुत अच्छा लग रहा था, आज सुबह से प्रॉब्लम हो गया. Till yesterday I was feeling so well, I was so excited, I completed all my work in my office, I completed all my homework, my child completed all my homework, he was so well, he ate well, he drank well, he played well, we had a good time, and today he's suddenly ill. No one is going to tell you that I am not feeling good today, but I was feeling well yesterday. It will be the other way around. Okay, so it will be something like कल तक तो सब ठीक था, आज तकलीफ शुरू हो गई, या till yesterday I was feeling so good, the weather was good, the complaints were good, I was not having any problem, I was improving with your medicine if he is a chronic patient. But today suddenly, due to weather or due to what not, God knows what not, my complaints started. This is what Ellen mentions in psorinum. Feels unusually well day before attack. अब जब पेशेंट को दिक्कत हो रही है तब आपके पास आएगा ना, एक दिन पहले तो नहीं आएगा. He will not come before one day. He will come to you on the day of attack or maybe even after the day of attack. So you will need to catch this from their words, and if you don't understand, you can just ask them, how did the complaint started? And maybe the patient will tell you that कुछ नहीं, कल तक तो कुछ भी नहीं था, सब ठीक चल रहा था, मैंने तो आज का अपॉइंटमेंट भी ले लिया था, यहाँ जाने का वहाँ जाने का, आई हैड scheduled my this appointment, this meeting, this work, my child was planning to go to school, project था, ऐसा था वैसा था. There will be something which they must have kept, on their calendar, because they were so fine, and suddenly this comes up. Psorinum is the medicine you should give. Next we see all excretions, diarrhea, leukorrhea, menses, perspiration have a carrion-like odor. It's a foul smelling something that is kept for 5 days, 10 days, 15 days, and it smells like, stinks like anything. Going further, we have despondent, fears he will die, that he will fail in business during climaxes, making his own life miserable and that of those around him intolerable. Now I would like to ask, there are a few viewers on YouTube and few viewers on Instagram. Can you all for a moment open synthesis repertory and check the rubric tormenting others? Just go and check it. I want you all to check it right now. Open synthesis repertory. I believe everyone has it on their phones. If you don't have it, just try to Google it or maybe find it from anywhere. But open the rubric tormenting others and tell me the remedy names in it. Can anyone mention the remedy names? Tormenting others, rubric in synthesis repertory. Is there anyone who can quickly mention about Agaricus tarantula? Tormenting others, is it? Yes, fit homeopath. I think it's Dr. Priyanka, is it? Alumina, psorinum, calcarea. Yeah. So the one of the top remedies what we have in tormenting others, इसमें psorinum है. So believe there is a person that he's an old guy, in the home, and he's telling everyone, do this, do that, do this, do that. He makes the lives of everyone around them miserable. That is what is mentioned in Ellen, and this is taken as an extension and mentioned in the rubric. So if you read Ellen's keynotes, you are already there what is there in the repertory, and you need not by heart the repertory, but if you know the exact symptom which is mentioned over here, despondent, fears he will die, which is a kind of a pessimism, the rubric already we discussed, which is there, the symptom that is there. Fears that he will fail in business during climaxes, making his own life miserable, and around that life around those people around him intolerable. So if you don't have the latest synthesis repertoire or maybe a few version older, I think the one of the remedies is tormenting himself and people around. Some there is a rubric tormenting people around him. It has three remedies. One of the remedies is psorinum. Other remedy is income. I think the third remedy is agaricus or something. So let's go further. But do remember this thing that it is about a person who is thinking negative and who is also tormenting people around him. That is what psorinum is all about. Let's go further. Hungry in the middle of the night. Ellen says in Ellen's keynotes, for psorinum we have the symptom hungry in the middle of the night, must have something to eat, just like Sina and sulfur. Many times patients will not tell you that they are hungry. They actually don't go and eat, but they drink water and sleep. And the feeling of hunger and the feeling of desire for water is more or less close to each other. So if they can't go out and get something which is freshly cooked or something from the refrigerator, they don't want to take it, they will drink water and sleep. I have cured many patients based upon this symptom. I have just confirmed with them whether they have had requirement of water or they felt hungry or kind of empty at night, and this has helped me cure many of the chronic complaints of patients. So hungry in the middle of the night or when they are going to sleep. Going further in Allen's keynotes for psorinum, we have profuse perspiration after acute diseases with relief of all suffering. The other two remedies mentioned are caladium and natrum. Now when you go back to my recording of natrum muriaticum, what you will see is that in the last part I have spoken that natrum is the only remedy mentioned in the Kent repertory for symptoms ameliorated by sweating. Open Kent repertory, chapter perspiration, symptoms ameliorated while sweating or after sweating. The only remedy is natrum, and there is a sub rubric which says if the headache is worse, you will have eupatorium perfoliatum and China and chinum sulf or something like that. So if you have a patient who says that पसीना आने के बाद इतना फ्रेश लगता है, I can't tell you how fresh I feel after the perspiration. That is natrum for you, that is caladium for you, that is psorinum for you. Caladium has its own set of prescriptions, but think of psorinum and natrum. Okay. Going further, we have the symptom which is sleepless from intolerable itching or frightful dreams of robbers, danger, etc. The other remedy is natrum. Now we have the symptom related to some children who are pale, delicate, sickly. Sick babies will not sleep day and night but worry, fret and cry, just like the remedy Jalapa. Child is good, plays all day, restless and troublesome and screaming all the night. This is reverse of lycopodium. So when we read lycopodium, we will get to know what is mentioned. But for you to understand, the children are very much restless day or night, anytime, and they are very much more or less playful during the daytime and more restless during the night time. There is headache which is preceded by flickering before the eyes, by dimness of vision or blindness. We saw this also in natrum muriaticum. The other two remedies mentioned over here are lac defloratum and calibicronicum. Or if the headache also has black rings or black spots. Now what is interesting about Allen's keynotes is that if any symptom is mentioned in bold, that symptom accompanies the disease everywhere in the patient. So when we have a case of headache, and if they have hunger, and if they feel better by eating, the remedy to prescribe is sorinum. The other two remedies mentioned are anacardium and califos. So we saw hungry in the middle of the night mentioned just few minutes ago. It is mentioned in bold if you open Ellen's keynotes. The same hunger symptom is mentioned with headache in bold, and that is what is the speciality of Allen's keynotes. Whatever is mentioned in bold, it goes through and through with the patient throughout its symptomatology. So there will be headache, always hungry during, better while eating, from suppressed eruptions or suppressed menses, better by nosebleed, just like melilotus. Hair is dry, lusterless, tangles easily, glues together, just like lycopodium. And there is plica polonica, borax, sarsaparilla, tuberculinum are the remedies. Scalp is dry, moist, fetid, suppurating eruptions, oozing a sticky, offensive fluid, just like graphitis and mesarium. So you have some patients who have eruptions in their head, borders of the head, necromure. But if the eruptions also have sticky, offensive fluid, think about sorinum, graphitis, mesarium. Intense photophobia with inflamed lids, cannot open the eyes, child or person lies with face buried in the pillow. So patients who have eye complaints, they don't want to see the light because it aggravates. You can think of sorinum. In ear complaints, we have humid scurfs and soreness on or behind the ears, oozing and offensive viscid fluid. The remedy mentioned is graphitis, but interestingly, we also saw this in petroleum, we also saw this in sanitula. So, something that is mentioned in one of the remedies, but not necessarily it will be mentioned over here. But you need to keep in mind in the back of your mind and be ready when you need to prescribe. So there will be otorrhea in many of the psoric patients, sorinum indicated patients, thin ichorous fluids, horribly fetid discharge, like decayed meat, chronic after measles or scarlatina. Next we have throat complaints, quinsy, tonsils greatly swollen, difficult, painful swallowing, burns, feels scalded, cutting, tearing, intense pains to ears on swallowing. It is having along with this profuse offensive saliva, tough mucus in the throat, must hawk continually to not only feel better in the acute attack but to eradicate the tendency. So if there is painfulness of tonsils with the complaints described, profuse offensive saliva, tough mucus in the throat, think about sorinum. But if it is painlessness, think about baryta carb. I know there will be a set of people who will say that baptisia mention किया हुआ है तो हम baptisia क्यों नहीं दे. Baptisia will be indicated in cases where there is much progression and it is purplish looking tonsils, so it is kind of a disease which has existed since 5 to 10 days, all the remedies have failed, or the patient has landed to you after 5 to 10 days of complaints and not immediately. If they are landing to you immediately, think about sorinum, think about baryta carb, think about aconite belladonna and not those remedies. What we read in college, what we prepare ourselves to answer in viva voces, in college examinations, written or oral, is not necessarily expressed exactly or more in number in clinical practice. It can be actually the opposite. So the sorinum patient hawk some cheesy balls size of pea of disgusting taste and carrion like odor. The remedy is calicine. Patients will have asthma, dyspnea aggravated by open air or sitting up and better by lying down. Very interesting modality. Usually patients will feel aggravated by lying down, but here he feels better by lying down. and keeping arms stretched apart. This is reverse of arsenic. And again you have the negative symptom which runs throughout the psorinum or the history of psorinum, which is he is despondent with the asthmatic attack and feels he will die. Now we will almost think of giving arsenic to such patients because you know that arsenic have these tendencies of speaking negative or predicting their death or saying something about their non-improvement. But psorinum has also the same symptoms, and if you closely read it you will give result in many of such cases. Coughs return every winter. Hay fever appearing regularly every year, the same day of the month, periodicity is there. With an asthmatic, psoric or eczematous history, patient should be treated the previous winter to eradicate the diathesis and prevent a summer attack. The cough is there after suppressed itch or eczema, chronic of years duration, aggravated mornings on waking and evenings on lying down, just like phosphorus and tuberculinum. Sputa is green, yellow, salty, mucus, pus-like coughs a long time before he expectorate. Again, the offensiveness runs throughout baryta carb. So we have the irritations which taste like rotten eggs. This is also there in arnica, entemtart and graphitis. There is diarrhea which is sudden imperative, similar to aloes and sulfur. The stool is watery, fetid, smells like carrion again over here, and it happens at the night. We saw this also in sulfur. I also told that it's there in strontium cow. And if the diarrhea happens after acute diseases or in teething children or when weather changes, think of psorinum. Ellen mentions next about psorinum that there is constipation, obstinate with backache and from inactivity of the rectum. Another remedy actually you should think of is aesculus. But over here, if you have given sulfur to the patient and he is not better, think of psorinum. Patients who will pass urine in the bed, especially the children, or old age patients who do not have the control over bladder, think about psorinum, especially during full moon or obstinate cases with a family history of eczema. So that is why we have the importance of asking family history. If they have had traits of psoric history, think of psorinum. There is a mention slightly one sentence about chronic gonorrhea of years duration that cannot be suppressed or cured. The best selected remedy fails. You can think of psorinum. Last but not the least, we come to some female symptoms which are leukorrhea, large clotted clumps of intolerable odor. Again, the odor is manifested over here. Violent pains in the sacrum, debility during climaxes. During pregnancy, most obstinate vomiting. Fetus moves too violently when the best selected remedy fails to relieve or correct the psoric diathesis of the unborn. So I believe in pregnancy you should give some patients a dose of psorinum, a dose of sulfur and a dose of medorinum, so that the tendencies of the parents are very much clear. You should give it at some duration apart. In skin we have driven to despair with excessive itching, acne, all forms of acne. So don't go berserk over what remedies are there for acne. Give psorinum and you will see half of the acne disappear immediately. Whether it is acne simplex, acne rosacea, aggravated during menses, from coffee, fat, sugar, meat, when the best selected remedy fails or only palliates. That's what I told you. Abnormal tendency to receive skin diseases, eruptions easily suppurate. We also see this in Hepar sulf, and there is dry inactivity and rarely sweaty dirty look of the skin as if it is never washed. Coarse, greasy, as if bathed in oil, bad effect from suppression by sulfur and zinc ointments. That is why when you have a patient from the dermatologist, you should ask them if they can provide you with the prescription what was given to them. That's where you will be able to give them psorinum or sulfur or zincum. Psorinum should not be given just for the psora or psoric diathesis, but like every other remedy, upon strict individualization, the totality of symptoms, and then we realize its wonderful work. Psorinum is complementary to sulfur and tuberculinum, and you can follow well with the other remedies known as alumina, borax, hepar, sulfur, and tuberculinum. After lac aceticum in vomiting of pregnancy, you can give psorinum. Arnica, if given in traumatic affections of ovaries, you can give psorinum after that. And sulfur follows psorinum well in mammary cancer cases if you ever get a chance to see. There is a quote by P.P. Bell, and he says that whether derived from purest gold or purest filth, our gratitude for its excellent service forbids us to inquire or care. So, the remedy psorinum is taken from the diseased materials which are discarded, which are not of use, but it is still useful and beneficial in so many of cases. So that's all from me right now, and I hope you all are enjoying the Ellen's keynote study streak. It was day 11, and I hope you all are studying along, and we'll see again with the next set of remedies tomorrow evening.